For a long time, I've practiced in general obstetrics and gynecology and really found an interest in caring for women in those later stages. I really felt that kind of need and that calling to really help ladies with those conversations and those problems that they don't want to talk to their maybe primary care about or their general GYN. So my specialty is urogynecology. Within that specialty, we focus on women with like pelvic organ prolapse, urinary incontinence, pelvic floor disorders like high-tone pelvic floor dysfunction. We do see younger ladies as well, ladies premenopausally or in their 30s and 40s that may have some struggles with like pelvic floor dysfunction, painful intercourse, things like that. But mainly it's an older population. Initially, we're just getting that history, what's been going on, what's been most bothersome, how long has this been going on. We do an exam typically with that initial consult visit because that might guide kind of our treatment decisions. And then we just have a conversation about what are the next steps? How can we help? What are you interested in? What have you tried? What hasn't worked? And what we can do moving forward. I do in-office like endometrial biopsy, so to evaluate for maybe some abnormal bleeding, abnormal uterine bleeding. I also do vulvar biopsies to rule out any concerns with like vulvar cancer or disorders of the vulva. Specifically do a procedure called PTNS, which is percutaneous tibial neurostimulation. Big words, but really it's an in-office treatment for overactive bladder. I'm also a certified menopause specialist, so I also help women navigating perimenopause, menopause. So we talk about hormone therapy, non-hormonal therapies to help with the symptoms of perimenopause and menopause. We see them every 3 months for years and years and years. So I personally built a pretty close relationship. We talk a lot about family dynamics and what's happening in their life. And for some ladies, this might be sometimes the only time they get to talk with somebody. So I feel like I built a pretty strong rapport with my ladies, and we have a lot of personal conversations sometimes too. So I think what makes this particular field rewarding for me is that we can help ladies with those challenges that are just day to day, helping them be able to achieve those, like just going out to dinner, just being able to do something normal, right, that they haven't been able to maybe do for months or years is really what makes a difference for me. So when I'm not in the office, some of my hobbies, I enjoy reading. I have a dream of owning a bookstore someday. I also enjoy exercising, and one big passion is I own a nonprofit dog rescue.